already joined. So let's start the meeting, okay? Is Rida on board?
Yeah.
Yeah? Rida?
She's here but muted.
Yes, I'm here.
Okay. Okay,
Hi.
so
Good morning, everyone.
you're good that we start, okay?
Yes, Lala, let's go ahead.
Okay, so good morning, everyone, again. We're pleased to welcome all of you who are with us today. I'm Nisia Danawi. I'm the GBV specialist at UNFPA Lebanon, United Nations Population Fund in Lebanon. So during this event, UNFPA, in collaboration with ABAD, will be launching the mapping of the gender-based violence programs, services, and policies in Lebanon report. We will be also featuring or showing the essential services package material that was contextualized and developed in Lebanon jointly by UNFPA and ABAD. We will be also announcing by the end of the event the rollout of the essential service package among key sectors in Lebanon, which will happen in the coming a few months before end of December 2021. So you will be hearing now a welcome speech by Ms. Asma Kordahi, who is the head of office at UNFPA Lebanon. Over to you, Asma, and welcome again.
Thank you, Nisia. Sabah al-khair jami'an. Good morning, everyone. So my opening remark is going to be in English. And again, we apologize for the non-English speaking audience. We hope that in the future, we will be able to accommodate the needs of our audience. Thank you, everyone, for being here with us today. We are very pleased also to welcome you and to welcome our partner, ABAD, to this meeting. In today's gathering and on the occasion of the World Population Day, which was marked earlier this week on July 11, we are launching the Mapping Gender-Based Violence Program, Services, Policies in Lebanon report and the Essential Service Package material. In a reference to his repeated appeals for a ceasefire in conflicts around the world to focus on the shared struggle to overcome the virus, the Secretary General of the UN, Mr. Antonio Guterres, pointed out that violence is not confined to the battlefield. He said, "Peace is not just the absence of war. Many women under lockdown for COVID-19 face violence where they should be the safest, in their homes. Today, I appeal for peace in homes around the world. I urge all governments to put women's safety first as they respond to the pandemic." Those were the words of the UN Secretary General earlier this year. Dear colleagues, evidence showed that GBV rates around the world have increased during the pandemic, and the limited access to assistance during the lockdowns increased the survivors' vulnerability, which increased the urgency of GBV service provision and policies. Lebanon is no different than the rest of the world. In the first month of the lockdown, the internal security forces recorded a 56% increase in reported domestic violence incidents. National GBV service providers reported receiving 4 times as many calls in May 2020 as compared to March 2020, with a 40% increase in receiving the calls. 69% of GBV incidents reported through the GBV Information Management System in 2020 are incidents of domestic violence. During the lockdown, tensions can easily mount within the household as families are confined to their homes. The dire economic situation in Lebanon also contributed to the rise of stress and anxiety, leading to an increase of the risk of domestic and intimate partner violence. The mapping of gender-based violence programs, services, and policies in Lebanon, which we are launching today, significantly contributes to the critical need for coordinated action in addressing and responding to violence against women. This report investigates the current services and policies in place in Lebanon and assesses how they align with those set out in the essential service package. The report also indicates what additional resources may be required in order to provide the quality services set forth in the essential package. We are confident this resourceful compilation will be of great use for various GBV actors and providers in Lebanon, but also a good model for other countries in the region. I would like to express my sincere appreciation to all of you who generously helped us make this event come together and those who helped in the development of the report. We would like to express particularly our gratitude to each of the 181 women community members and to the different key informants and government stakeholders, including the Ministry of Interior and the Internal Security Forces, the Ministry of Justice, the Ministry of Public Health, the Ministry of Social Affairs, the National Mental Health Program, and the National Commission for Lebanese Women, who volunteered their time, resources, and input for the data collection and validation activities. UNFPA will continue to collaborate with its partner Abad and other partners to ensure that we end all forms of discrimination against women and girls and that no one is left behind. Building on the findings and recommendations of the review of the health, justice, and police and social essential services for women and girls survivors of violence in Lebanon, UNFPA, in partnership and collaboration with Abad, will roll out the essential service package among these three key sectors during the coming months, and we will keep our partners informed on the outcome of this rollout. I conclude my notes with a quote from the statement of UNFPA Executive Director, Dr. Natalia Kanam, on the World Population Day. Dr. Kanam said, "What does lead to health and productive societies is when women can make informed choices about their sexual and reproductive health, and when they have access to services to support their choices. A woman who has control over her body gains not only in terms of autonomy, but also through advances in health and education, income, and safety. She is more likely to thrive, and so is her family." Thank you very much for listening, and I welcome you again. Over to you, Nisia.
Great, thank you so much, Asma. Now we move along to Ms. Rida Anani, founder and director of Abad. Welcome, Rida, over to you.
Thank you, Nisia. And actually, just to be responsive to the audience, I'm gonna do the speech in Arabic just so we can balance a little bit and complement what Mrs. Asma was saying, if you don't mind. I know that also the report is in English, the video is in Arabic, so let's try to do that mixed method, if I can say. فإذا تلبية يعني كمان بعرف العديدين منكم وشكرا كثير على المشاركة والاهتمام بهذا اللقاء وبهذا الإطلاق لهالموردين إنه يكون باللغة العربية. موائمة لهذا الوضع رح أعمل يمكن الترحيب باللغة العربية، وهيك بتكون فرصة أيضا لمشاركة أيضا موجز على النقاط اللي تفضلت فيهم مسز أسماء كرداحي شركائنا بهذا المشروع، وايضا شركائنا يمكن بالنضال ايضا بملف انهاء العنف القائم على النوع الاجتماعي. فشكرا بدايه للشراكه مع صندوق الامم المتحده للسكان، واللي هي شراكه بنعتبرها امتداد للرؤى المشتركه فيما يختص بتعزيز المعرفه وتعزيز الوقايه والاستجابه لإشكالية العنف القائم على النوع الاجتماعي في لبنان، بأيضا تقاطعيتها مع قضايا الصحة والحقوق الإنجابية والجنسية الخاصة بالنساء والفتيات. يمكن هالموردين هن محاولة إعادة تأكيد على نقطتين أساسية. أولاً أهمية المعرفة وبناء البينة فيما يختص بماذا يوجد وماذا يحدث على الأراضي اللبنانية، سواء من حجم المشكلة أو ماذا يتوفر من خدمات ومن فرقاء ملتزمون بالاستجابة لإشكالية العنف القائم على النوع الاجتماعي، وأيضاً إطار معرفة على مدى التكامل والتنسيق أو التكرار لبعض الجهود من جهة للقدرة على التخطيط وبناء البرامج وتعزيز السياسات بصورة قائمة على بينة وعلى إدراك للواقع، وبالحيز الثاني أيضاً إعادة تأكيد على أهمية جعل أصحاب الحقوق، صاحبات الحقوق، المستفيدات أو ما يعرف كان بالضحايا والناجيات من العنف في محور عملية التخطيط والعمل السياسي، وأيضاً تعزيز حقهم بالوصول إلى خدمة ذات جودة تحترم كرامتهم الإنسانية وأيضاً الخدمة الشاملة. اليوم التقرير والموارد التي تم إنتاجها المصحوبة أو المقرونة بهذا التقرير لإيصال حقوق وواجبات النساء بصورة مبسطة وسلسة على الميدان، والوصول إلى الخدمة بأنماطها المختلفة سواء القانونية الحقوقية أو المختصة بالعدالة الجزائية الأمنية والمرتبطة بالضابطة العدلية أو الصحية الطبية على تنوعها من طب شرعي أو طب صحة عامة، صحة نفسية وطب نسائي أيضاً، الاجتماعية والوصول إلى الإيواء الآمن المؤقت بحالات الطوارئ والوصول إلى خدمة إدارة الحالة وغيرها. كل هذا الحزمة هي ما حاولنا أن نقوم به بتعاوننا تحت هذا التعاون مع الصندوق المتحد للسكان لتعزيز وصول النساء إلى الخدمة ومعرفتها حول وجود هذه الخدمة والاستناد على ماذا يوجد من موارد أو من توفر لهذه الخدمات على الأراضي اللبنانية ووضعها بتصرف هذه النساء. نقطة أساسية مهم أنه يمكن أن نشير لها، هذا العمل اللي عم تقوم فيه UNFPA بالتعاون والشراكة مع أبعاد هو عمل غير منفصل عن جهود وطنية أوسع فيما يختص بتفعيل وتعزيز وأعمال الإطار التنسيقي العام المختص بالإجراءات التشغيلية الموحدة الوطنية الخاصة بالاستجابة للعنف القائم على النوع الاجتماعي في لبنان، واللي تم تطويرها بالتشاور مع مختلف وكالات الأمم المتحدة وبدعم أساسي من الحكومة الهولندية وأيضا شركائنا ب-RDPP، اللي هو أيضا مشروع هادف أيضا إلى تعزيز الاستجابة السياسية وتعزيز إصلاح النظام الاستجابة في لبنان ونكون عم نوصل لنوع من نمذجة. فهذا التقرير هو مكمل لهذه الجهود، وحزمة الخدمات هي أيضاً من الأدوات الأساسية التي ستكون مقرونة بكافة التدريبات الوطنية للي عم نقوم فيها بالشراكة مع الوزارات اللي تفضلت أستاذة أسماء وذكرتهم، وتحديداً وزارة الشؤون الاجتماعية ووزارة الصحة ووزارة الداخلية بشكل أساسي، باعتبارهم بالخطوط الأولى مع النساء ودور حيوي في إيقاف دائرة العنف وفي توفير الخدمات المنقذة للحياة بأوضاع عديدة وسيما يمكن بأيضاً مدعيات الاعتداء الجنسي. فهذه الحزمة ستدمج ضمن الإطار الأوسع ومن ضمن التدريبات المختلفة البايلوت، يعني اللي حتكون اختبارية بالمرحلة الأولى لتضمينها ببعض المناهج المعتمدة من قبل هذه المؤسسات بشكل دوري ودائم. اليوم هذه المحطة هي واحدة من الجهود اللي عم تقوم فيها منظمة أبعاد أيضاً مع UNFPA ومع الشركاء المختلفين بإطار تحديداً محاولة تعزيز مبدأ العناية الواجبة على الدولة فيما يختص بدورها الأساسي في توفير أفضل خدمة بتوفرها بالإمكانية الوصول لها على اختلاف أو أحوال وأوضاع النساء على الأراضي اللبنانية، وأيضاً تكون ذات جودة ومجانية أو تكون قابلة لإمكانات الأشخاص. بالختام يمكن مهم أن لا نعزل نفسنا يمكن عما يحدث في الأزمة في لبنان والأزمات المركبة التي عم نعيشها. مهم الإشارة اليوم هذا التقرير يمكن أنجز بما قبل استفحال الأزمة إذا فينا نقول بالعام المنصرم. UNFPA أبعاد حاولنا أنه قبل الإطلاق نعمل تحديث لبعض البيانات وسيما الجهود اللي حصلت بالاستجابة بمرحلة الجائحة جائحة كورونا، لأن العديد من المواد والعديد من الجهود قام فيها قطاع العنف القائم على النوع الاجتماعي في لبنان العامل في إطار الطوارئ الإنسانية. تم تضمينها، ولكن طبعا بنعتبر هذا المورد او هذه الدراسه هي يعني مستند حيوي دائما قابل للتطوير والتحديث حسب الجهود اللي هي عم نقوم فيها، ولكن الموارد المقرونه فيه اليوم هي موائمه للواقع الحالي، وعم نحاول انه نكون عم نستثمرها على قدر المستطاع على المستوى الميداني لتعزيز الوعي وتعزيز الوقايه للنساء، ونقدر نوصل لهم ايضا وراء الابواب المغلقه، يمكن اذا مش من وراء الجائحه، من وراء يمكن الواقع اليومي المعيشي المؤلم للي كلنا عم نعيش فيه، بعدم يمكن امكانيه حتى الوصول للمراكز اللي عم تقدم الخدمه نتيجه الوضع الاقتصادي وعدم امكانيه تحمل اكلاف النقل وغيرها. مجددا نشكر مشاركتكم، حنكون في مساحه طبعا للنقاش اذا في اي استيضاحات، ونترك هلا يمكن المساحه اكثر للتعرف على ابرز نتائج هذه الدراسه والموارد اللي تم انتاجها مقرونه فيها. شكرا مجددا لليو ان اف بي اي على هذه الفرصه وعلى الثقه الدائمه والشراكه مع المجتمع المدني بهدفنا المشترك، يمكن باعاده الدور الطبيعي اللي لازم تقوم فيه على امل في لبنان باعاده بناء نظام فعلا مسؤول وقادر على تلبيه حاجات المواطنين والمواطنات على اختلاف جنسياتهم على الاراضي اللبنانيه. شكرا نيسيا.
Thank you, Rida. Thank you so much, and thanks to Abad for hosting this event, and thank you for your constant collaboration. We've been partnering with Abad throughout the previous years, and I'm sure this partnership we will be moving forward with this partnership again and again in the coming years. Now we will be moving along to Mr. Jay Frali, who will be presenting the findings of the report as well as the recommendations. Jay is affiliated to Abad, so welcome Jay, and over to you.
Thank you so much, Nisia. Hi, everyone. Thank you for being with us today. I'm just going to highlight one thing for the non-Arabic speakers that Rida said. Basically, I will be speaking a little about the essential services package at large and the program under which this report was done. One of the important things that Rida mentioned was that this report was updated in 2019, and the update was done largely pre-crisis and pre-pandemic. So it is a living document. There is some information which may require updating now to reflect the current reality. We did do a sort of contextual review and adaptation in December 2020 to sort of reflect the local response on the ground, particularly by local civil society organizations, WROs, and UN agencies, including and especially UNFPA. So without further ado, I'm going to share my screen. Media team, can we please enable screen sharing? Excellent. Is it visible to everyone?
Yes, Jay, looks good.
It is.
Wonderful, thank you. So, how the Essential Services Package was created. Basically, in December 2013, the UNFPA, UN Women, WHO, UNDP, and UNODC developed the Joint Global Program on Essential Services for Women and Girls Subject to Violence. The purpose of this program was, one, to address the gap between the international commitment to GBV response and the actually in-country implementation, where there was a significant rift. And the second purpose is to encourage help-seeking behavior among GBV survivors, be they women or girls. Then in December 2015, which is 2 years later, the ESP, which is the Essential Services Package, and is a set of standards and guidelines for any national multi-sectoral GBV response, was delivered, and it targeted 4 key sectors. Number one, the services sectors, which are the health, police and justice, and social services, as well as coordination and governance structures. Now, a few facts which are mentioned in the report that we did extract and wanted to showcase right now to show the importance of such a package. are the following. 1 in 2 people have mentioned that they know someone who has been subject to domestic violence. 65% of reported incidents by individuals who were interviewed were domestic violence at the hands of their own family members. 18% of reported cases did involve sexual violence, and of those, 8% were rape. And then another 2016 study in the Bekaa found that 35.64% of adolescent Syrian refugee girls aged 15 to 19 years old are currently married. So in 2019, a similar study that was done in Syria for the same age bracket showed that it was like child marriage was substantially lower at 11.58%. So once the ESP began to roll out in Lebanon under the UNFPA Abad partnership, 3 key tools were developed. And those were, number 1, the mapping update and the report, which we will speak about shortly. This consisted of basically updating and redeveloping the Lebanon country report, which was basically 1 country out of the 10, which was a larger scale Arab states report commissioned by UNFPA Arab States Regional Office. Then we worked on developing an ESP animation video in Arabic. So we worked on making it accessible to the local context. And this is what we will be sharing shortly. It is strictly in Arabic, both voiceover and the animations. And what we did was we tried as much as possible to make sure that it's an accessible format for individuals who may have hearing disabilities, as well as visual. And this is why the voiceover on one hand, as well as the text on the other hand. And finally, we created a complementary community brochure which covered the key elements of the ESP, informing women, community members, as well as service providers about, sorry, بس إذا ممكن نعمل mute. Thank you. Basically it was a complementary to and inspired by the animation video. So it has a lot of the elements from the video, and it has information in an easy to read method. So the key results of the program were the adoption of the ESP, the Essential Services Package, at direct service provision points, which could be listening and counseling centers, women and girls safe spaces, and safe shelters, temporary safe shelters for women and girls. Case managers were trained to offer all-inclusive holistic care packages to survivors, which is basically what the ESP talks about. There's also an ongoing rollout and scale-up of the Essential Services Package. So this has started since 2019 and continues until today. In women's shelters and safe spaces, so Abad and UNFPA partners, with continuous monitoring and technical support from UNFPA Lebanon for the rollout. It also created a one-stop shop model, which is something that has proven to be very strong and very effective on the ground, because all of a survivor's key needs and issues are dealt with in one go. So she doesn't need to go from one center to another hierarchical structure to another government structure. Everything can be dealt with in one place, and then any referrals are done more easily. Cost and time efficient GBV case management. So this reduces survivor case dropout. Generally, whenever processes can get too lengthy, whenever costs can get too high. Right now, we were just speaking, let's say also, Rida mentioned the high costs of transportation or being able to get around, limited mobility to seek different complementary services if scattered in multiple cross-country structures. So this sort of combines everything and also assists the survivor getting where she needs. Then there's also a higher number of served survivors in case retention. So there has been an observed reduced drop in survivor attendance of holistic care package services, especially since all of their needs are managed in one location. This puts an end to their visiting numerous locations for each service type. And this consequently increases survivors' trust in the safe space where they are going to receive services, in their own personal feelings of protection and safety, as well as in more consistent case follow-up. Now, The facilitating factors for the ESP and for Abad and UNFPA to have been able to roll out this program so smoothly were the fact that there had been civil society efforts and partnerships with local governance structures already existing and being fostered, which created the fertile ground to mainstream the ESP. Such examples include the national GBV SOP, which have already been endorsed by key stakeholders from Justice, Security, Health, and Social Affairs ministries, which means automatic endorsement of the ESP because they're both interrelated and complementary. Law 293 on domestic violence, which was passed in 2016 and aims to protect women and criminalize domestic violence. The repeal of Law 522, which was abolished in 2017 and which used to allow rapists to escape persecution once they married their victim. And the ISF mandatory service memos on family violence cases, which was in 2017, and on sexual assault and human trafficking in 2018, which have been quite important. There has also been an increased focus on GBV in national strategies and action plans, such as the National Women's Strategy, the National Strategy to Combat Violence Against Women and Girls, and the National 1325 Action Plan. There's also been an increased acceptance of work around GBV, albeit gradual, which has created a conducive environment for intervention implementation, even in some more conservative communities, which is also something that we have been observing on the ground slowly, increasing acceptance. And then the UNFPA adoption of GBV and reproductive health integrated package, which has been consistently scaled up by NGOs and government partners, as well as health and social structures. Some of the challenges, as well as the mitigation of the rollout of this program, have been, sadly, the lengthy ministerial bureaucratic processes, which to provide endorsement to any new initiatives, including the ESP. So a lot of bureaucratic processes had to be navigated through. But through partnerships and consistent UNFPA and Abad follow-up, this had been achieved. Some local NGO resistance to altering their own work modality and integrating new concepts. So it's common for too many organizations who have a specific way of operating to not want to embrace something that alters completely what they have already been doing. So there was some resistance faced, but Abad and UNFPA worked on a lot of training, a lot of partnership, a lot of lobbying for the ESP. And on updating institutional knowledge and onboarding the NGOs working on case management. Also, the current situation, which is and has been affecting national priorities starting from October 2019 and on to today. However, UNFPA and Abad, as well as their partners, continue to work on ensuring that steps are taken to integrate ESP into organizational as well as national priorities, particularly when it comes to case management processes. The best practices have been embedding the ESP into the national GBV SOP. So this was a great step forward. It was an opportunity for remedial action to overcome challenges. It was a natural complementary component, and it created the higher level of structured mainstreaming to enhance service delivery on a national level rather than scattered and sporadic efforts. So it sort of unified everything and created a more robust way forward. Then there were the multi-sectoral sensitization efforts on ESP. So there had been demonstrated willingness to cooperate with civil society on GBV efforts, which was a great step forward. Simultaneous training on dealing with survivors, provision of certain services, and safe referrals. And those were done with ISF representatives, as well as judges, lawyers, and forensic doctors, all of whom were open to actually working with UNFPA and Abad and receiving training on ESP and related efforts. Health and reproductive health staff, midwives, doctors, nurses, hospital, and primary healthcare staff. Centers. Mental health specialists as well, psychologists and psychotherapists, National Mental Health Program, and Ministry of Public Health partnerships. Now, we move on to speak a bit about the report. So this was the report that we developed, The report itself was part of, as I previously mentioned, the Mapping GBV Program Services and Policies in the Arab States. It covered 10 countries, and as we said, it was developed by UNFPA Arab States RO and the International Center for Migration, Health and Development in Geneva. This was done in January 2018. Then in December 2019, UNFPA partnered with Abad in order to review the content specifically for the Lebanon report, to update all of the information that was there, expand as much as possible, validate once this was created with different stakeholders. So I will talk how we did this in a second. And then we created the standalone report. In December 2020, 1 year later, we just added the COVID-19 update. The report itself highlights the national legislative framework, policies, and services available to GBV survivors in Lebanon. So basically, this is all available inside the report. We're not going to go into it in too much detail. We're just going to speak of the key summaries regarding the services that are available. And then the mapping also details GBV protocols and services, assesses their alignment with the ESP itself, and offers actionable recommendations to inform future GBV programming and policies in Lebanon. So how we did that was, first of all, as always, we would go for secondary data to ensure that we have a lot of information, or as much as possible, because there wasn't something centralized. We did 20 focus group discussions with the 181 women that Asma mentioned, aged 18 to 19, 51% of whom were Syrian refugees and 49% of whom were Lebanese host community members. We also did key informant interviews with different ministry representatives, including the Ministry of Interior, Internal Security Forces, the Ministry of Justice, Public Health, and the National Mental Health Program, the Ministry of Social Affairs, and the National Committee for Lebanese Women. And then once we created the report, we did validation meetings with key stakeholders. Now, the limitations of this report were the following. First of all, the ad hoc and unstructured nature of GBV surveillance, which kind of limits what we were able to put in as stats. A culture of stigmatization and secrecy, which leads to underreporting and incorrect estimates or even assessments of overall GBV burdens and needed interventions on the local level, as well as lack of centralized governance structures dealing with GBV reporting, monitoring, documentation, service management, and coordination. This unfortunately leads to insufficient information about what actually is available as services, because there could be NGOs providing very strong services, but nobody could know about them because maybe they haven't been able to promote them sufficiently. So there was a lot of reliance on word of mouth and networking. The contextual update that was done, we spoke a bit about the contextual challenges, which were the economic crisis, COVID-19, as well as the tragic Beirut blast, which have disproportionately affected women, leading to cases of violence being compounded by quarantines, social isolation, job and income losses, which also exacerbated the effects because they created social stress as well as negative coping strategies. Reduced mobility as well as reduced access to remote services. So despite the fact that too many organizations actually tried to be responsive and move to remote service modality for women to be able to access them, even though they may not be able to pay for transportation, they did have issues regardless related to connectivity, expenses associated with internet or phone calls, as well as privacy, because when you're home with everyone all the time, it's really difficult to try to reach any sort of confidential services and speak freely. There was also hampered access to justice because of the increasing number, severity, and types of GBV cases. Also the different, like the types have increased. So for example, because now we have increased reliance on remote services, so increased reliance on the internet, cyber stalking, cyberbullying also became issues, while they may not have been so dramatically affecting people before. Also strained capacities of protection actors in safe shelters because of the increased need. Heavier burden on marginalized groups like migrant workers, including financial and not getting their dues, sex trafficking victims, as well as LGBT individuals who also may have had to be closer to their families, especially, let's say, post-blast, they may have had to move back in home with their families. Then economic pressure. So when studying stats, women faced higher layoffs than men did, as well as higher wage reductions than men did. There has been limited access to assistance received by a household. So because too often assistance goes to the self-identified head of household, which is usually the man, women did not really have access to this cash, as well as increased unpaid domestic care work responsibilities, forced labor, as well as digital gender gaps. So for example, where women may have sought employment through the internet, because often or sometimes, let's say, there may be a gender gap in access to internet or in skills related to the internet. These went more to men than women. And also, as we mentioned, the LGBTQ have become increasingly vulnerable to economic pressure because too many of the locations post-blast, which may have employed LGBTQ, closed. Then health sector challenges. So sexual and reproductive health access has been reduced. Period poverty has seriously been increasing. There have been a lot of mental health concerns. Frontliners are very pressured, also undervalued, also underpaid. And despite all of that, they are still underrepresented in decision-making. And obviously, we're talking about females here. Next, we move on to coordination and governance. So the key findings related to coordination and governance were the following. There are national task forces or coordination structures that are in place. So the key initiatives that are taking place on the local level are coordinated through inter-organizational platforms. So this can include the National GBV Task Force, the GBV NTTF, and the GBV SOP, which has been endorsed by most. Then the next 3 points are average, so they definitely can stand to be improved. There have been some steps towards them, but they are insufficient. So centralized data collection. There is no centralized national system to collect and share data or generate evidence, but there are some systems like the GBV IMF, like Activity Info, which are used by UNFPA, UNHCR, and UNICEF partners, who are providing response services under the LCRP. So while this is an excellent step towards sort of centralizing some data, it still is not sufficient because the organizations that are partners at the time of this report were 11 only. Centralization is also currently pending activation of the SOP National IMS. So the SOP that were developed and endorsed by MOSA, as we mentioned, stipulate, let's say, having a national information management system. Then there has been some government support. So there has been engagement and political will of some structures, especially those whom we mentioned and thanked. But there remains some continued resistance to addressing certain human rights violations. So there is a shy response towards child marriage, towards giving women the right to abortion, and other personal status issues. National strategies and policies. There have been quite a few which have been developed, and those are included in the report if you'd like to take a look. Ministry and CSO actors have jointly been working on developing them, and there are several in existence. But the big problem is, while they exist and while they are very important and very strong maybe, there is no allocated government budget to actually apply them. Health services. So sexual and reproductive health services are in existence. There have been some efforts to improve the quality through training and creating guidelines addressing SRH issues, such as abortion, STIs or HIV due to rape, life-threatening pregnancies, and again, this is related to abortion, and high-caliber clinical management of rape at trained facilities. Provision of SRH IEC material, which is information and educational material. These are available and provided at health facilities. So when we did conduct this report, we found that they were in existence. So this is a strong point. Post-exposure prophylaxis. The PEP kits are being provided by UNFPA to different health facilities throughout the country following training on CMR. but it is very crucial to increase the availability. And PEP should be free for all survivors, because currently it's limited more to refugee populations rather than local populations, and there are some conditions either way. Free care for GBV survivors is also absolutely crucial. So coordination structures locally have successfully negotiated for free GBV service provision, but it does remain inaccessible to some populations. Police and justice services. Free legal assistance and advice exist, but they are limited. And those exist either provided by civil society or also to a lesser extent by the Bar Association. Free accessible forensic medicine services are not existent. So there has been, while there have been some efforts of organizations, including ABAD, training forensic doctors in partnership with the Ministry of Justice on how to receive survivors, this is still insufficient. We have heard too many stories of survivors feeling completely uncomfortable when they go to visit forensic doctors, and there's no free access to forensic reports, which actually do cost hefty amounts. So they are unaffordable for women too often. Legislative protection against SGBV. So there has been progress on the level of modifying protective legislation. So either repealing certain texts, as we mentioned, amending others, or introducing new legislation. This has been done. But marital rape remains legal, and legal texts are still not comprehensive. Survival, personal security, and protection, there is limited availability and uptake. So the ISF has been engaging with civil society, participating in trainings of trainers. They did issue the mandatory memos that we mentioned, and they are running a hotline on domestic violence, which is the 1745 hotline. But it still requires improvement on the national level. Social services. Counseling and mental health support are available and quite widely through NGOs, as well as MOSA social development centers, which are run in partnership with NGOs. And these provide Lebanon-wide coverage because they are strategically selected and available across the country. Information and advocacy is also available, and organizations have really been working to put out information everywhere, from posters to roadside billboards, leaflets, using mainstream as well as social media, phone apps, and community outreach. So basically, they have really tried to vary the methods in order to reach as wide a group as possible. Telephone hotlines are available. They also include a limited number of 24/7 services, insufficient. With the exception of the ISF hotline, all active hotlines are actually largely handled by civil society rather than local governance structures. Safe shelters have limited capacity for accommodation. This has been the case for either way. When we did the report, we actually found 10 different shelters throughout the country, but that's not sufficient as a number. And with the onset of the pandemic, as well as the crisis, they have been affected. So some have had COVID-19 breakouts at the center. Others are taking too many precautions, which are restrictive and not allowing women to access them as needed. Targets can be very selective in some cases, and there is no standardization in the operation modality. So some of the services that are available on the social level are the safe spaces and safe sheltering, as well as case management and holistic care, 24/7 helplines, legal aid referrals, awareness raising, rehabilitation for men with aggressive behavior, which also is an important complementary activity, family support sessions, life skills sessions, and economic empowerment, PSS using art techniques, group support and counseling, as well as mental health referrals, be it to psychotherapy or to psychiatry. Now, the recommendations. So based on the information that we identified, the key recommendations that we came up with were to promote the delivery of a holistic and integrated service package to women and girl survivors. So while this has started, more work needs to be done on it. To amend and introduce new legislation, launch public opinion campaigns to foster approval, and this should be done on a regular basis. launch a proper CMR strategy with Ministry of Public Health endorsement. Law strategies and standard operating procedures should be inclusive and intersectional in order to target individuals with disability and individuals with different intersecting identities who may face more problems than other individuals. Also apply reasonable accommodations for survivors with disability because too many service structures are inaccessible. Improve coordination of GBV service delivery and increase public awareness about availability because too many services may be available, but too many people may not know about them. SGBV-related services, especially forensic medicine, should be made available free of charge to all survivors with no exceptions. Ensure systemic outreach to vulnerable populations in hard-to-reach areas, including those with legal status concerns. So too often refugees, individuals who are stateless, individuals whose residencies have expired, may not feel comfortable trying to reach out to obtain much-needed services because of fear of deportation or detainment. Assess available services quality and availability, and this should be a regular instance that is taking place, because accountability is crucial. And that's about it. So before we show you the video, we will speak a tiny bit about next steps. Following the needs identified, basically 10 SGB focus group discussions took place with different women on ESP tools with the GBV survivors themselves. We identified their needs. We spoke to them about the tools, about what they may need, and we catered the trainings that we are delivering based on these identified needs. Once they were structured, the next steps now will be to target participants from the 3 service sectors, and this will be being rolled out until November 2021. So we are targeting these 3 key services sectors, which are the health, police and justice, and social services sectors. For the health sector, basically the participants came through the health working group calls for applications, as well as the Ministry of Public Health network of primary healthcare centers. They will target nurses, midwives, doctors, and other frontliners because they are all often the first line of professional contact with intimate partner violence or SGBV survivors. So they are the gateway, so they are maybe the most important sector to target. Police and justice, so we'll also be targeting 50 ISF officers involved in investigation, security, and protection of GBV survivors. So whether they are going to conduct investigations or whether they are present at police stations where women may go to report. And finally, the social services sector, also working group calls for applications, as well as MOSA social development centers. It will target 50 social workers who are engaged in crisis information and helplines, safe accommodation, provision of legal rights and referral information, and they will receive training which is complementary to the national GBV SOP rollout trainings, which, as Rida mentioned, are currently being done in partnership also with the Dutch Ministry of Foreign Affairs and RDPP. And thank you for listening.
Thank you so much, Jay, for the super comprehensive and straightforward presentation. That was really great. And we would consider this as a call also and for participation. Those who feel interested in joining the upcoming trainings, they're more than welcome to do it. So now we will be moving on to screening the IEC material that was prepared. So I guess Cynthia will be in charge. Cynthia?
Yes, Nisha, we are sharing it right away.
All right, great. Thank you.
Thank you.
And then we will open the floor for questions in case any of the participants has some questions. So here we go.
We can't hear the audio.
Yeah, Cynthia, we still cannot hear the audio. Now we can.
ويتميز بتفهم وتقبل المجتمع حول العالم. تتعرض سيدة من بين 3 سيدات للعنف. لكن ما هو العنف؟ العنف هو أي سوء استخدام للسلطة والقوة ممارس ضد النساء كونهن إناث، ويتميز بتفهم وتقبل المجتمع له أنواع مختلفة، منه العنف الجسدي كالحرق، الخنق، الضرب وصولاً إلى القتل، والعنف الجنسي كإجبارها على الحمل أو الإجهاض، الاغتصاب، الالتهابات المنقولة جنسياً والتزويج المبكر، والعنف المعنوي كإهمالها، تحطيم ثقتها بنفسها وطردها من المنزل. أما العنف المادي فيتمثل بالاستيلاء على أموالها، حرمانها من الإرث، عدم الإنفاق عليها، إجبارها على العمل أو منعها عنه، وأخيراً العنف الكلامي كالسخرية، الشتائم، الصراخ والإهانات المتكررة. للعنف نتائج جسيمة وعديدة، منها على صحة المرأة كالتسبب بكدمات، كسور، تشوهات وحروق وتوتر واكتئاب وصولا للانتحار، وعلى العائلة كإحداث خلل في الأدوار الأسرية، الطلاق، تفكك الأسرة والتأثير على نمو الأطفال. أما الأعباء الاقتصادية فمنها كلفة الخدمات الاجتماعية كالمتابعة القانونية والإيواء الآمن والرعاية الصحية وانخفاض الدخل والإنتاجية. وأخطر نتائج العنف تكون على الطفل، فمن شعور بالذنب وعدم الأمان إلى صعوبات مدرسية وعدوانية وانحراف. لكن يمكن كسر دائرة العنف من خلال سعي النساء للحصول على الدعم والخدمات. فاعلمي أيتها المرأة أن من حقك الحصول على خدمات متخصصة وشاملة تضمن لك الحقوق والحماية مع احترام خصوصية وضعك وإمكانياتك وقراراتك. لذا عند طلب الخدمة والدعم عليك التأكد من أنها تحترم استقلاليتك، حاجاتك، عمرك، سلامتك وحقوقك الإنسانية الكاملة مع أولوية مساءلة الجاني. واعلمي أن الخدمات الصحية التي تحصلين عليها يجب أن تشمل الرعاية الصحية الأولية وخاصة عند التعرض للاغتصاب والدعم النفسي الكامل، وأن الخدمات الاجتماعية المقدمة تتضمن التوعية حول الحقوق، تقديم المشورة، الإحالة إلى مراكز الإيواء الآمن في حالات الخطر، الدعم والتمكين المادي، خدمات خاصة للأطفال، وخدمة الخط الساخن على مدار الساعة. واعلمي أيضاً أن خدمات الشرطة والعدالة عند التوجه إليها يجب أن تشمل التحقيق، الاستشارة القانونية والتمثيل القضائي مع احترام السرية التامة، محاسبة المعتدي قضائياً والوقاية والحماية. إن توافر وتنسيق الخدمات يساعد في وقف العنف، فتنعم الأسرة عندها بمجتمعات أقوى، السلام والأمن، أطفال أكثر صحة، انخفاض الجريمة، تحسين الإنتاجية وارتفاع الدخل. تذكري، لست وحدك، الخدمات المتخصصة متوفرة، فلنضع حداً اليوم للعنف ضد النساء والفتيات.
Great. Thank you so much, Cynthia. That was really interesting. So, colleagues, if you have any questions to raise, any clarification, please feel free to raise your hands, and then we will give room for questions and answers. يلي بحب يطرح أي سؤال أو عنده أي استفسار ما بيهم باللغة العربية أو باللغة الإنجليزية، اللغة يلي بترتاحوا فيها. بليز إذا فيكم ترفعوا إيدكم أو بتحبوا دغري تطرحوا السؤال، تفضلوا.
أنا رافعة إيدي، شكرا جزيلا.
تفضلي.
أنا بس أطلب من أبعاد إذا ما تصير مع عليهم، يعني شلون يزودونا بالفيلم.
سوري بشو؟
الفيلم.
الفيديو. أوكي.
نعم.
نحط ديجا ست شذا بالشات، نحط لينك من خلاله ممكن الاطلاع على الفيديو بشكل مباشر، موجود على يوتيوب كمان تشانل تبع أبعاد على الويب سايت، وايضا رجعت حطيته هلا الزميله سينثيا مجددا، وايضا في مطويات مرفقه بهذا الفيديو اللي فيه بقلبها التبسيط يعني الرسائل الاساسيه تحت كل قطاع من القطاعات والخدمات، ايضا ممكن تحميلها من هذا الرابط.
شكرا زميلتي العزيزه غاده.
Kamin, I would like to add to what Rida mentioned. The report has been also posted, and you can access the report through the link shared by our colleagues. فالتقرير كمان ممكن يلي بهمه يطلع على التقرير ممكن الحصول عليه من خلال الضغط على الرابط يلي موجود بالشات بوكس.
ست هاجر ايضا رافعه ايدها. نيسيا
تفضلي هاجر.
Yeah. Hi. Good morning. Thank you, Rida. Hi, everyone. I had a question regarding the one-stop stop with all the services, and I was wondering if there was a strategy in terms of the distribution, the geographical distribution, across the territory, and if this strategy included. I mean, obviously, you've been, and thank you, Jay, for the very comprehensive presentation of the report. You've mentioned this partnership with NGOs, with the UN agencies, with local actors, and so I'm wondering if this, if indeed there is this strategy, if there are different actors that are involved in it, and if there is, you've mentioned onboarding of organizations that are providing GBV services. Are there specific criteria to be part of maybe this network, just like there is a network of PHCs that is run by MOPH? Is there like a plan, a strategy to put this kind of network? And if yes, would it be under the authority of the Ministry of Social Affairs? Yeah, if you could please provide a bit more information on that. So I guess my question is addressed to you, Rida, or maybe Jay, if you don't mind. Thank you.
Can you just present yourself, Hajar, from which organization?
Yeah, sorry. So, apologies. So my name is Hajar Shamoun, and I work for ACTED as a protection project coordinator.
Okay, very nice to meet you. Asma, would you like to reflect on the work done on that front, or you want me to do so?
Yeah, please go ahead, Rida. Thank you.
Okay. So basically, Hajar, thank you for actually raising this question, because it's quite, I would say, timely, and at the same time, it's quite vital if we are like really to see all these efforts done by UNFPA and different NGOs working in the sector and other UN agencies, like really see that concretely being operationalized on the ground. And actually, there is a work done on the level of Ministry of Social Affairs. I'm going to highlight that and then maybe leave to Asma the work done by the MOPH on the level of PHCs. But actually, the vision is currently, MOSA conducted a kind of a review of all the SDCs in an aim of cutting down the number of SDCs and then having like a number of SDCs becoming a model centers divided across the Lebanese territory where they can provide the holistic package protection services, if I can say, which will be inclusive to family protection, inclusively gender-based violence and CP response, in addition to the integrated ESP service and the SRH component as part of it. And these centers actually will be committed for the operationalization of the national GBV SOP and the national CP SOP, which has been already completed and piloted and validated and endorsed by the different ministries. And these centers are going to be the pilot on that front, okay? This is envisioned in the coming months. Parallel to that, already as UNFPA and Abad and other partners, we're gonna be conducting the pilot rollout, also testing for this package and also the remote GBV case management guidelines as a contingency of possible new lockdown that might occur, but also an aim of having these centers and SDC social workers be trained so they can also be modeling that kind of practice in an integrated way. So there is a strategic vision on that level. The Ministry of Social Affairs is committed already on that front, and the Ministry of Interior and MOPH. We're continuing the conversation, of course, with other ministries, but this is in the pipeline. In addition to that, there is also the effort being conducted by MOPH in the modeling of PHCs. I'll leave it, Asma, maybe she can highlight that better than I can.
Thank you, Rida. Very quickly on the Ministry of Public Health. So UNFPA has been in partnership with the ministry for more than 20 years, specifically to strengthen the access to sexual and reproductive health services and information. So specifically, and in what concerns this particular ESP package, there has been partnership that is directly and indirectly linked to the ESP. At the normative level, we have worked with the Ministry of Public Health to develop standard operating procedures and guidelines on sexual and reproductive health. They are being updated every 5 to 7 years, depending on the need, the additional aspects that have to be integrated. And they have been fully adopted by the Ministry of Public Health across all the primary healthcare centers, as well as in all the health dispensaries. Linked to that, the axis is on the training and capacity development. So we have trained all the service providers affiliated to the primary healthcare centers of the Ministry of Public Health on the standard operating procedures on reproductive health. We also developed procedures on family planning, recently on mental health and pregnancy, last year on COVID and reproductive health. So all we try to update those guidelines based on the needs. So the training is ongoing because obviously the primary healthcare centers and other dispensaries have a turnover of healthcare providers, and we need to make sure that all of them are trained on quality services. And the third one is basically the integration of GBV into the SRH, package. This has been done in the past 4 to 5 years. We have invested a lot of time, efforts, resources, and innovation, as well as piloting, to make sure that we are integrating GBV and the SRH package at the primary healthcare level through a very systematic and consistent approach. The model has been elaborated into a manual with 3 different models: the basic model, the intermediate model, and the more advanced model. It's going to be piloted in full this year in 17 primary healthcare centers, and the objective with the Ministry of Public Health is basically following the piloting to make sure that this is being scaled up to all the 240 primary healthcare centers that are operating in the country. This is in a nutshell the work that we have been supporting, of course, with all the awareness raising and the subsidization of some of the services in where need be. All this is ongoing with the Ministry of Public Health. Over to you.
Thank you so much, Rida and Asma, for the clarification. I'm sorry, I'm not being able to see if someone has raised her hand. So
Taline, actually.
Dalal?
Taline from Mena Rosa.
Go ahead.
Yes, hello everyone. So Taline Torikian, I'm the project coordinator of Mena Rosa. We are a regional network of women living with HIV in the MENA region. I'm very sorry if I missed it during the presentation because of electricity cut. I was kicked out of the conversation. And I just wanted to pinpoint on the interlinkage between gender-based violence and sexually transmitted infections. I don't know how much this was present in your study, and if you have any data, or did you collect any statistic regarding this? Because in the work we have been doing for the past 3 years, specifically with key population and women in all their diversity, meaning sex workers, trans women, single mothers, refugees, migrant workers, etc. We have noticed that how much it's gender-based violence is interlinked with STIs and specifically HIV. In addition to that, just your video is amazing. It really did mention sexually transmitted infections as a gender-based violence form, but it would have been even greater if you could have mentioned some referrals, because you're saying to women to react and to report and to seek help, but it would be great to have some phone numbers and some referrals and some addresses available for everyone. Yeah, thank you very much.
Yeah, thank you, Taline. I would just like to answer this last part of your question, and I'll give the floor to colleagues to address the first part of the question. Regarding the numbers, as you may know, UNFPA has been chairing the GBV task force at the national level. And in collaboration with all the GBV actors, there has been development and dissemination of IEC material whereby the updated numbers of the different actors, be it through hotline, are published and disseminated to everyone. So I'm not sure if you are attending those GBV task force meetings, but irrespective, if you can share your email address, we can put you in touch with the GBV task force chair, and you will get the invitation to attend the national meetings, and we can share with you all the updated numbers whereby people can call and seek help. In addition to Abad, of course, who is operating a hotline number, there are many NGOs across the Lebanese territories who are operating hotline numbers as well, in addition to the national hotline number operated by the internal security forces. So this task in terms of coordination has been really successfully completed and updated regularly in collaboration with all the GBV actors. And you can also find an updated mapping of the different services per geographic area as well, because the updating of the mapping of actors and referral pathways is a regular task that's been taken place at the level of the GBV task force, be it at the national level or at the field level throughout the country by the different GBV working group chairs, co-chairs, and members. With regard to the first part, whether STI...
Perhaps I can answer that, Nisya.
I just wanted to say, yes, we are part of the mailing list. Maybe we are not able to attend every couple of weeks, but yes, we are aware of that. But I meant after the video, since the video is addressed to women, we have the numbers, definitely. We have the resources, but also if the video is addressed to women, it would be also beneficial to share these phone numbers and hotlines with the women, at the end of the video. This is what I was meaning.
Okay. All right. Okay. I thought you weren't aware of the coordination platforms that are being in charge of disseminating these numbers. But yeah, point well taken, and we will see what can be done at this level.
If I may... okay. Jay, would you like to answer? Because I think Talene raised a very important question on the linkage of GBV with STI.
You can take that. I just wanted to mention one thing about the numbers. We actually consciously did not include something because we had created it as an awareness raising tool. So basically we did it in a way that anyone can use it, or any of the partners could use it, and then during a session, and then actually speak about their own services. So maybe you want to use it, and then if you're providing, let's say, mental health services, you want to refer them to your own mental health services. You know, this is why we hadn't restricted it to one of our numbers.
Thank you, Jay. Absolutely. I mean, I remember when we worked on this report, we agreed that this is, this can be used by any partner and not restricted to Abad or any, partner. And I think this is the beauty of this manual, is that it really contains, this mapping of the programs, policies, resources, and any partner can really make use of it. So specifically on the question that was raised by Talene, I think this is very interesting what you raised, the linkage of GBV with STI. To the best of my knowledge, I don't think we have any concrete data on that specifically. As you probably know, Talene, there's no prevalence on STI in Lebanon. There are anecdotal evidence, about STI coming from our implementing partners on the ground, from the ministry. But as I said, there's no prevalence, there's no surveillance system. And there's also poor reporting by beneficiaries on STI to a large extent. This is a challenge that we have had, and there is an ongoing discussion now with the Ministry of Public Health to try and put in place a system where we can, first of all, there's need for a public awareness campaign on STI, I think public, but also regional. There's also need to avail testing, services that are at a very, very nominal fee or free of charge. And we also need to encourage, the community members to report on that. So, precisely on GBV, I mean, there isn't a national system on that. And so I'm sure that at the linking it to GBV, the data is not available. But I think it's a very important point. And perhaps our GBV partners could look into maybe, capturing specific data with some of the victims related to STI. Over to you, Nisya.
Yeah, thank you, Asma. Thank you, Jay. Thank you, Talene. I don't see any hands raised. Please feel free to jump in if anyone has any question. So it seems no one has any question to ask. So then the meeting has come to its end. Thank you, everyone. On behalf of Abad and UNFPA, I would like to thank all of the speakers and the participants. As mentioned previously, you can find the link to the report, to the IEC material in the chat box. UNFPA and Abad will be advertising very soon, as mentioned by my colleagues, the rollout plan across the 3 key sectors, the security, the health, and the social sectors. So we will be very happy if you can disseminate the calls to your respective organizations, and if you can encourage your colleagues and interested people to join the trainings, which will be organized very soon and which would need to be completed before end of November 2021. Thank you again. Rida, Asma, colleagues, do you have anything to add?
Thank you so much, Nisia, and thank you everyone for joining. Please stay tuned for the upcoming announcements, especially those working in the sector, for the trainings that's gonna be organized. It's very important, I guess, at this very critical and timely moment in the country, and being equipped by all these tools, I guess, will help us all to be better prepared shall any new emergency, additional one, arise. So thank you, everyone. Thank you, Nisia, and thank you for the UNFPA partnership.
Thanks, Rida. Asma, do you have anything to add?
Nothing. I echo what Rida said. It's a great collaboration with Abad as usual. We look forward to concrete outcomes and to improving the well-being of women and adolescent girls. And yes, absolutely, stay tuned, everyone. Thank you, everyone, for your participation.
Great.
Thank you so much, everyone.
Jay, anything to add? Thank you again.
Thank you, everyone, for listening, and Nisia for facilitating, and Asma and Rida for all your work and help on this. Take care, everyone.
Great. So thank you all. Thank you so much. Bye-bye.
باي باي. شكرا لجهودكم، شكرا لأبعاد. نتمنى مرة ثانية أن يكون التفاعل أكثر إذا كان مترجم.